From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Ijoma Unyato.
Hello and welcome. NCDC announces 6 new confirmed COVID-19 cases in Nigeria, 2 each in Kwara and Edo, and 1 each in Rivers State, as well as the FCT, bringing the total number of confirmed cases in Nigeria to 238. President Buhari approves 500 billion naira special intervention fund to address disruption caused by COVID-19 pandemic, including upgrade of healthcare facilities in states across the country. Court sentences Nollywood actress Funke Akindele and her husband Rashid Bello to 14 days of community service after the couple pleaded guilty to the charge of flouting social distancing order. And UK Prime Minister Boris Johnson taken into intensive care unit in hospital after his coronavirus symptoms worsened. Plus, we'll have business, sports, news from Abuja, the FCT, and later on international news from our London studios.
On business news tonight, global ratings agency Fitch lowers Nigeria's credit rating to B with negative outlook.
And on sports news, Manchester City manager Pep Guardiola is in mourning after losing a family member to the dreaded COVID-19.
And from Abuja, Nigeria, the United Nations launched single basket to coordinate all donations from UN members for the COVID-19 fight in the country.
The figures for the coronavirus cases in Nigeria continue to climb as the National Center for Disease Control today confirmed 6 new cases. 2 of the new cases are in Kwara, another 2 in Edo, and 1 each in Rivers and the Federal Capital Territory. This now brings the total number of cases recorded in Nigeria to 238. The NCDC also confirmed that 35 patients have been treated and discharged, while 5 deaths have been recorded. A breakdown of the case in each of the states show that Lagos now has 120 cases, FCT Abuja 48, Osun with 20, Edo has 11 cases, Oyo 9, Bauchi has 6 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Enugu, Ekiti, Kwara and Rivers each have 2 cases, with Ondo and Benue states recording 1 case each. However, the NCDC is yet to confirm 1 case reported by Kaduna State and 2 others in Ogun State. Meanwhile, the Presidential Task Force on COVID-19 is set to announce a national policy on the use of face masks to prevent further spread of the pandemic. And that's according to the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazo, during a news conference by the Presidential Task Force in Abuja. The chairman of the task force also has been explaining what the role of the invited Chinese medical experts would be in response to agitation from the Nigerian medical community.
It's week 2 of the daily briefing by the Presidential Task Force on COVID-19, which also coincides with the second week of the presidential lockdown in Lagos, Ogun and Abuja. Both the Minister of Health and the Director General of the Nigeria Center for Disease Control informed journalists about what they have achieved within the 1 week of the lockdown, as well as plans to announce a policy on the use of nose masks.
We have tested over 5,000 samples so far and are working hard to scale up capacity in a targeted approach. The increase in cases with no clear epidemiological definition will mean that there will be a need to discuss changes in our public advisory. This will be after the Ministry of Health and its agencies have sat down to review and analyze the situation.
I did say we will release a policy on face masks this week. That policy has almost been completed. In fact, the draft is now being looked at by various colleagues to make sure that we're all aligned. And tomorrow or next, we'll be releasing that policy for all of us to align with together.
The chairman of the Presidential Task Force also speaks about the role that the medical team expected from China would play in the management of the pandemic.
The support coming from China is a corporate social responsibility initiated by CCECC, a company with a total volume of infrastructural contracts in Nigeria worth over 10 billion naira. As a matter of fact, they have become the expert in that field because it started with them. No other person can give you better information of management of COVID-19 better than the Chinese. So I don't think we should allow ourselves to be dragged into unnecessary controversy. They are not accredited by the Nigerian Medical Association or Nigerian Medical Council. They can't practice here. They won't see our patients. They won't manage our patients. They will offer their experiences. So they are bringing their people for the installation of the specific machines that they are bringing in.
The decision by the federal government to accept help from Chinese medical experts have generated so much debate among Nigerian medical doctors since it was announced last week. However, the Presidential Task Force appeals to Nigerians, especially the medical community, to recognize the fact that COVID-19 is a borderless disease that needs international collaboration to defeat.
More interventions are being announced by the federal government to tackle the COVID-19 pandemic, and these include plans to withdraw $150 million from the Sovereign Wealth Fund for distribution to federal, state and local governments. According to the Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, the money is expected to help tackle the impact of the pandemic on the economy. The finance minister explained at a media briefing that the global disruption caused by the pandemic makes it imperative to adopt these measures.
The emerging health and economic risks resulting from the COVID-19 pandemic and decline in international oil prices pose threats to Nigeria's economy as well as its healthcare system. And the federal government at several meetings has identified plans on how to reduce the burden of the virus and its impact on the economy through various interventions.
Thank you, and sit down.
The latest of such is coming from the Ministry of Finance.
Can we clap for her?
Besides the 500 billion naira intervention fund, the government is proposing other measures to help state and local governments withstand the shocks of the pandemic.
With regards to the special works programs, Mr. President has previously approved pilot special works programs in 8 states to be implemented by the National Directorate of Employment, the NDA. This approval was given in early this year, and the works were supposed to take place between February and April 2020, and I'd like to report that these works are currently ongoing. Mr. President has now approved that this program be extended to all 36 states and the FCT.
That is not all. There are other palliative measures to assist the poor and vulnerable.
The President has approved drawings from the Strategic Greens Reserve. The Nigerian Customs had in its custody a lot of rice that has been seized, and there's 150 trucks of rice that is now being handed over to the Humanitarian Ministry for distribution to the states across the Federation.
A total of $3.4 billion is expected from the International Monetary Fund, $2.5 billion from the World Bank, and $1 billion from the African Development Bank.
We have also applied to the International Monetary Fund for its COVID-19 rapid credit facility to draw from our existing holding within the World Bank IMF group. This loan will not be tied to any conditionalities. However, let me just state here and clarify that Nigeria does not intend to negotiate or enter into a formal program with the IMF at this time or in the foreseeable future.
The effects of COVID-19 is still taking its toll on the nation's economy. But interventions such as these can only be described as timely in reducing the impact.
Now let's look at these fiscal palliatives in a bit more detail now. Joining me live is the Managing Director of Cowrie Asset Management, Mr. Johnson Chukwu. Thanks a lot, Mr. Chukwu, for joining us from where you are.
Thank you for having me. Good evening.
Good evening. Now, we're looking at so many figures that we continue to hear, and the media just have to ask these questions when they come up. Starting off with the 500 billion naira COVID intervention fund. Looking at the critical areas that are listed for intervention, what's your assessment of what you're hearing now?
Well, the first thing I feel is that the government is taking the necessary measures to moderate the impact of this pandemic on the citizens. But starting from the 500 billion you just mentioned, let's look at how it will impact, or the policies, the areas it's going to be invested in. While they mentioned the issue of enhancing medical facilities across the country, also supporting state governments in improving the standard of their medical facilities so that they'll be able to manage this crisis. I think that's very important. But the key thing is that beyond those interventions, because if you look at improving the medical facilities, I don't think it's something you can actually improve immediately. So the key, what we should focus on are the palliatives. What are those measures we need to put in place? Take, for instance, a state like Lagos that has proven that it has the competence to manage this crisis. I think they need to put a lot of resources to such states. But to start up new facilities might take a longer time to achieve. But it's good that the government has started something. The 500 billion will go a long way. They also mentioned they want to create public works in all the same way as in 4 local government from the 500 billion. That may be a stretch. Let's focus on 2 things. One, moderating or minimizing the transmission of this virus within the country. And 2, providing palliatives to those most vulnerable in the society who are finding it difficult to stay back at home and not earn their daily living. So those should be a priority for now. Support the existing facilities so that we can manage and moderate the rate of infection or community infection in the country. And 2, support the most vulnerable so that they can tidy themselves through this crisis period.
But in terms of the strategy itself, I mean, we're hearing quite a few figures. Like I said before, $3.4 billion to be drawn from the IMF. We then hear $2.5 billion to be drawn from the World Bank. What do you think is the best way it can be channeled so that those who really need these palliatives can actually get them? Yes, we hear this we hear these figures, but in terms of the strategy for sharing it out, are you impressed with or satisfied with the strategy?
No, I think we need to adopt a lot more technology in sharing out the palliatives or the social investment programs that will support the most vulnerable in this period of time. And I've advocated that we should look at their phone consumption. And one of the basic criteria you can actually measure the people's income level is their consumption of telephone services. If you look at those who actually load their phones with 200 naira or 100 naira on a monthly basis, they are the most vulnerable in the society. And I can tell you that given our level of telephone penetration, you can actually say that virtually every household has somebody who has a telephone line. And if you use those telephone lines and transfer money to them through their lines, you can actually transfer something like 5,000 naira to each of the lowest consumers. It may not be a perfect measure, but you are likely going to achieve something like 80-90% success rate in reaching out to those people. The approach of going to distribute 20,000 naira individually to hand out 20,000 naira individually is very difficult. One, it's difficult for you to cover a large area. 2, there is a risk of contagion within the population that gather together to collect these handouts. And the aspect of distributing food, they also have the same challenge. So I think we have to deploy existing technology. Let's use their phone consumptions and determine those who are the rung of the ladder and do electronic transfer to their phones. They can actually use those to any of the payment platforms and cash out the amount that you have transferred to them.
All right, Managing Director, Cowrie Asset Management. Thanks a lot for joining us, Mr. Johnson Chukwu, on the News at 10 tonight. Thank you.
My pleasure.
And in part 2, after the break, Lagos State government raises concern over increasing COVID-19 cases in Alimostra local government area. That's coming up in a moment. Do join us again.